Do you suffer with foot pain and are worried that there's no end in sight? Do you have foot pain and worried that your only option is either surgery or orthotics or nanoshoes? Make sure you check out this video. I'm going to go through a really great review we had recently and talk about the underlying cause of most foot problems and how we can do a great deal to help it without being reliant on orthotics, without having to go down the road of surgery, and so that you can still be active throughout the process. So a gentleman named Maurice who came to see us was very, very kind to give us a positive review. If you want to check out that I'm not making up this review, you can go to Sydney Foot Solutions and go reviews. And it's all there through Google. It's all done externally. But I did want to share this with you and hopefully this can help if you are struggling with foot pain. Maurice wrote, "There is a very clear plan on the journey to improve my foot ailment. It is well communicated and explained throughout the journey. If for some reason I have diverted from the plan, it is easily remedied by an updated plan, great experience and great outcome after the treatment." Now, I won't go into specifics on Maurice's treatment or what his condition was, but needless to say, he had some foot pain and he had some foot problems. What people don't realize is that most foot problems and most foot pain, whether it be heel pain, bunions, plantar fasciitis, that sort of thing, is usually related to a level of misalignment through your foot and ankle. And that misalignment is an inherited trait that affects the way you stand, the way you walk, and also it turns off your foot muscles as well. And as a result, it causes a great deal of compensations throughout your foot and ankle. And then causes you to get pain, inflammatory response, and flares up and stirs up those tissues. So it's really important that you're aware of why that's actually happening. And the benefit of what we do is that we can realign people's feet without being reliant on orthotics. You can still wear a variety of footwear and you can keep being active throughout that process. And often we can do that over a 6 to 12 week cycle of treatment. The way it works is just a very gentle hands-on technique, and then we give you exercises to support those changes. So the only reason I'm making this video is to just make you aware that some people feel very trapped, particularly when it comes to orthotics or even surgery in some cases. Obviously, the sooner we treat something conservatively, the better the long-term outcome that we do get. And so that people can come in and get individualized advice, not necessarily use our services, we offer a 60% off initial assessment offer. And the benefit of that is you can come in, you can get personalized advice from an experienced practitioner. In fact, we have over 20 years experience at dealing with foot problems. And as a result of that, we deal with lots and lots of specific musculoskeletal foot problems where people are having chronic issues or chronic pain. So make sure you check out our website at sydneyfootsolutions.com.au, where we can go through and check out your individual needs and then send you off for the relevant scans and help you if it's indicated. I hope this has been very helpful, and here's to you beating foot pain.